6 benefits of intermittent fasting for diabetes. If you have diabetes, you probably know by now all there is to know about diabetes. But did you know that fasting is one of the best ways to manage your diabetes? In this video, we will show you 6 awesome benefits that you can gain from fasting if you have diabetes. Intermittent fasting is a method of giving your body short fasting periods. Rather than a diet, it is an eating schedule meant to provide some health benefits. Theoretically, it works because, at a fasted state, your body is given time to repair damage. But given this method, you don't put your body at risk of entering starvation mode. There are now many ways to engage in intermittent fasting. The earlier method was commonly referred to as the 5-2 diet, wherein dieters were to consume only 25% of their recommended calorie intake for 2 non-consecutive days a week. On the other 5 days, they are free to eat anything up to their recommended daily calories. Today, the most popular method of intermittent fasting is eating within an 8-hour window daily. For the rest of the 16 hours, you're only allowed non-caloric beverages. While intermittent fasting is most popular among diets, it is most beneficial to people with diabetes. Here are 6 benefits of intermittent fasting for diabetes. 1. Reduces insulin resistance. Insulin is a hormone that prompts cells to either use or store glucose. When the body becomes insulin resistant, it no longer responds to insulin correctly. That leads to many health issues, including diabetes and obesity. According to diabetes.co.uk, intermittent fasting has been scientifically proven to reduce the risk of developing insulin resistance. 2. Helps lose weight. In an article published by Harvard Health Publishing, physician and clinical instructor Monique Tello, MD, MPH, describes the effects of intermittent fasting in fat reduction and weight loss. According to her, insulin levels drop enough during our fasted state to allow us to burn off fat rather than store it. 3. Lowers blood pressure. People who engage in intermittent fasting tend to maintain lower cholesterol levels. This is according to a study published by Nutrients in 2019. Lower cholesterol allows them to maintain good blood pressure. Consequently, they are at lower risk for serious illnesses like stroke, aneurysms, and even dementia. 4. Improves cardiovascular health. According to an article published by the Mayo Clinic in 2019, people who fast have better cardiovascular health than those who don't. This is due to several factors, not the least of which is the improved ability to reduce bad cholesterol in the body. Additionally, people who engage in intermittent fasting make better choices when it comes to the food they eat and how many calories they consume in a day. 5. Inhibits diabetic retinopathy. Diabetic retinopathy is caused by having high blood sugar levels for prolonged periods. Excessive glucose tends to damage the blood vessels inside the eye and eventually cause more problems like swelling and hemorrhages. According to an article published by the American Diabetes Association, intermittent fasting reduces the risk for diabetic retinopathy not just by controlling blood glucose levels. It also does so by improving gut flora, which has critical benefits to eye health. 6. Promotes mental clarity. According to a study published by the Journal of Neuroscience in 2014, intermittent fasting helps improve brain health. It enables you to think more clearly, even when you're outside your fasted state. It has also shown incredible potential in reducing the risk for Parkinson's as well as Alzheimer's disease. Additionally, it has proven to be effective in preventing and treating depression and anxiety. These 6 benefits of intermittent fasting for diabetes patients are so incredible that some believe they could go off maintenance and medication for good. Indeed, this lifestyle change offers remarkable health effects. But as with anything that affects your health condition, it's always best to consult your doctor before engaging in this eating schedule, as well as controlling your medication. Following are study references we used in the creation of this video. Thank you for watching. If you like the video, please share with your friends. And please subscribe to our channel if you haven't already done so. If you want to be notified of our new uploads, do the following. New subscribers, click on the bell icon when you subscribe. Old subscribers, please turn on all your notifications.